Hi, my name's Kristen Eagles. My student number is T00698082. Today I'm going to be discussing a cooperative veterinary care experience. So what cooperative veterinary care is, it's allowing the patients to decide whether or not they want to participate in their treatment. It's essentially giving them consent. So where it starts first is client education. So the owners need to have a discussion with the veterinary team to kind of understand what cooperative veterinary care is, and need to be provided with resources on how to prepare their vet or prepare their pet for that. So it starts with training. So whether it be getting their pet to sit on a mat and be handled, or to sit well for nail trims. So by using training and positive reinforcement in that, it makes the pet more willing to want to engage in the treatment. So it makes it a lot easier trying to get them onto the mat as far as getting their weight. It makes it easier for them being able to sit still for exams, and to come in and get their nail trim done. So from there, then we're moving into the clinic. So when the owners bring their pets into the clinic, we want to create kind of a positive environment for them. So providing lots of treats, lots of pets, scratches, kind of whatever they're most comfortable with, to kind of get them to engage with us in a positive manner. So to help create that positive experience within the clinic, food is always a great option. So providing food in the exam rooms before they start to be handled or before their vaccine can really help them to be more engaged. If there's any, struggling, or if they stop eating, then things should stop and kind of be reassessed, so that we don't kind of reinforce any negative ideas when it comes to coming to the vet. So coming back to the client, it's important that the client kind of knows what they're doing as far as training goes. If they're not keeping up with the training or anything, then it's just unfortunately not going to work very well. So again, kind of constant communication with the clients, and providing that education is really essential in making sure that this cooperative experience is a success. So in our clinic, we've actually had a couple of patients who have really struggled as far as anxiety and fear goes when coming into the clinic. So one of the doctors actually worked really closely with the client, to kind of get down to the root of the problem. So they went for behavior consults, medication was provided, and then gradually over the next few months, we tried to build up that dog's confidence when coming into the clinic. So we started first with just coming in for happy visits. So coming in and just kind of walking around, getting to see the people, getting used to the area, getting treats. And then working up gradually from there, coming out back, kind of sniffing the clipper or the nail trimmers, but not kind of fully going for the nail trim, and then eventually moving on to doing the actual nail trims. And eventually, that dog actually did eventually willingly participate in the nail trims. We didn't end up having to use a muzzle anymore, and everybody really was much happier. So what a cooperative care experience can provide is a much better experience for the pets, but also for the staff as well. Kind of less stressed patients equals less stressed staff. We're able to kind of see more patients in a shorter amount of time because we're not taking the time to have to restrain patients, that sort of thing. It uses up less staff, and generally happy puppies make happy staff. So all in all, it really helps to benefit everybody within the veterinary team and the patients as well. So my clinic isn't actually fear-free certified, but I've had some discussions with the head veterinarian about kind of implementing some more techniques for free to help kind of make that cooperative experience. And so far they've been quite open. So hopefully going forward, kind of all the staff can get on board to help make the experience more positive for everybody.